Hi, I'm Nicole Pratt. I'm from the University of South Australia, and today I'm going to be presenting on behalf of the International Society of Pharmacoepidemiology Working Group on the feasibility, evaluation and reporting of data linkage studies in pharmacoepidemiology. So I'm going to discuss the results of our efforts in developing guidelines for data linkage specific to pharmacoepidemiology, which covers the assessment of feasibility, evaluation of quality, and the transparent reporting of the data linkage process. So increasingly in pharmacoepidemiology, linking is required to enrich analytic data to more accurately define the study populations, to enable adjustment for confounding, and improve the capture of health outcomes. And when we create such novel linked data sets, researchers really need to consider their suitability to meet research objectives, assess source data for completeness and population coverage, and ensure well-defined data governance standards and protections exist. And while the record PE guidelines assist in the reporting of studies using observational health data specific to pharmacoepidemiology, they do not really address the unique requirements for transparent evaluation and reporting of the data linkage process. So the aim of our study was really twofold. The first was to provide guidance on data linkage appropriateness and feasibility to plan purposeful and sustainable new data linkages that advance pharmacoepidemiological research. And the second was to generate a checklist with specific recommendations to assist researchers in providing clear and transparent assessment of the data linkage process. So this study came about in response to a call for manuscripts by the International Society of Pharmacoepidemiology. And we formed two working groups, which comprised of members from academia, industry, contract research, government, and the regulatory agencies. The recommendations were developed by each of the working groups and were then posted in an open forum for comment by society members. And finally, the recommendations after the consultation process were endorsed by the Society's Board of Directors. The results of the efforts of the working group were then published as two companion papers in the Journal of Pharmacoepidemiology at the end of last year, 2019. So the first paper that I present here gives us guidelines for assessing the appropriateness and the feasibility of healthcare data linkage prior to embarking on the process of data linkage. The motivation behind this topic was really to ensure that prior to linking multiple discrete data sources, a careful assessment of the utility and the feasibility of that process was performed, and this was to enable the development of high quality scientific research resources. So prior to this study, such recommendations for the assessment phase prior to initiating a new health data linkage were lacking. So the working group developed 12 consensus recommendations covering the scientific and operational considerations for feasibility assessment of a data linkage that should be considered prior to beginning the data linkage project. So we came up with 12 recommendations that were listed here, which were then categorised into 5 key domains, which covered the following areas of consideration. The first, research objectives and justification. Second, data quality and completeness. Third, the data linkage process. Fourth, data ownership and governance. And fifth, the overall value that was added by the linkage. So within each of these key areas of research, scientific recommendations were made, or specific recommendations were made. So for example, we recommend that the suitability of the linkage to meet research objectives should be evaluated. We recommend that an assessment is made we recommend that an assessment is made of the source data for completeness and population coverage. And lastly, we recommend that an assessment be made of the data governance standards and protections. So this paper has really outlined a range of concrete considerations to evaluate prior to embarking on the data linkage activities, with the goal of helping researchers conscientiously assess and design sustainable linked data resources. And when we're creating novel linked data sets, researchers must assess the feasibility of both the scientific, including data quality and linkage methods, and operational aspects such as the access, data use and transfer, governance, and cost. So after completing the data linkage process, there are key aspects that should be reported. such as data quality and the specifics of the data linkage process to ensure transparency of the process and increase confidence in the usability of those data to generate actionable evidence. And that is exactly what paper 2 addresses. So this paper, published in conjunction with the first paper, addresses or provides guidance on the evaluation of the data linkage quality through the development of a checklist for reporting key elements of the data linkage process. So when generating a linked dataset for pharmacoepidemiology, researchers should be aware of 2 distinct issues. The first is around the validity of the linkage itself, and second is the potential for bias in those studies that arise from the linkage process. So therefore, our objective was to provide guidance to the community regarding the 2 key steps that must be performed after a data linkage process. The first is around a detailed evaluation of both the internal and external validity of the linkage. And second, a clear and transparent reporting of the linkage methods and the final linked data set. So we developed a comprehensive checklist which covers 5 domains, including the data sources, the linkage variables, the linkage methods, the linkage results, and the linkage evaluation, which includes validation and verification of the resulting linked data with a clear and transparent assessment of the linkage process. So when assessing whether the linkage process itself can lead to bias in pharmacoepidemiologic studies, 2 major sources of potential bias should be considered. An inaccurate combination of records, such as erroneously matching information that belongs to different individuals, and the reduced representativeness of the target population when compared with individuals included in the final, more highly selected linked data set. So for example, the quality of the linked dataset naturally relies on its accuracy, its completeness, and overlap of information contained in the data sources. So we recommend that researchers should specifically report the variables that they used for linkage, including those used for blocking, the quality of those variables, and any pre-processing or cleaning of those variables that were required prior to the data linkage process, including special handling or curation of those variables. Additionally, the evaluation of the data linkage process should report specifically an assessment of the linkage verification. That is, do the linkages results fit user needs and intended uses? The reporting of linkage verification can help a reader to assess whether the analytic data resulting from the linkage process are representative of the original or the target population. Also, linkage validation should be reported, and that is, does the resulting linkage dataset conform to expectations based on an external knowledge or on a reference standard? So reporting linkage validation can help a reader to really assess whether the linked data are accurate and meaningful. So in conclusion, our comprehensive guidelines for data linkage feasibility assessment and reporting can be used to inform the design of sustainable linked data resources by addressing the feasibility and appropriateness of establishing a linkage project prior to embarking on the exercise. And secondly, to increase confidence in the evidence generated from those linked data. And clear and transparent reporting of the data linkage processes can help researchers and end users to critically assess the potential for bias owing to the data linkage process. And together, these guideline papers really outline how linkage of existing data sources can be leveraged for the generation of high quality, actionable evidence for healthcare decision making. And lastly, I'd just like to acknowledge the great team I worked with to produce these guidelines and really thank them for their hard work. Thank you very much for listening.